Hi, my name is Hannah Blaylock, and I'm the nurse practitioner here at Radiant Reflections. And I've decided to start doing a couple of videos that will hopefully become a video series to go over various services that I provide and kind of give hopefully some education on various wellness topics just to kind of keep you educated and up to date and help you be able to take the best care of yourself. So I figured it would be best to start with the most common service that I offer, what more people come to see me for, which is weight loss, specifically use of semaglutide or tirzepatide. So today we're going to talk a little bit about semaglutide, what it is, how it works, the risks of it in the process. If you were to come see me, how we would go about kind of weight loss therapy. So what is semaglutide? It is in the family of what we call GLP-1 agonist or glucagon-like peptide agonist. So basically what that means is it mimics the GLP-1 hormone in our gut that is released when we eat food. And that hormone stimulates our body to produce insulin, which therefore lowers our blood sugar. So that is why it is used for diabetes, because it does help with blood sugar. It does help with insulin resistance, which often leads to weight gain, especially that weight gain around the gut. So it does help with managing blood sugar and weight from that standpoint. Another way that it works is it works directly on our brain to reduce our appetite and to signal that we are full, basically. So it helps us feel full much quicker, which in turn keeps us from eating quite as much food. It also works by slowing gastric emptying, which is another way to keep us full. Because it works by slowing gastric emptying, however, it can cause a lot of unwanted GI side effects. Those are probably the most common side effects that I see. So we're talking nausea, vomiting, diarrhea, constipation, bloating, heartburn can be very common. Usually when I see those, it is more so when people first start taking the medication or when they increase their dose. But typically it's not a lingering long-term side effect for most people. I also sometimes see people complain of dizziness, fatigue, and headaches. And again, those are usually when you first start taking the medication and do not linger long term for most people. So it does help decrease your appetite. It does help you feel fuller much quicker so that you're not eating quite as much. It does help stabilize your blood sugar and things like that. So it works in several ways as far as that goes. It is approved right now for people with a BMI over 30 or with a BMI over 27 with some type of medical comorbidity. So that would be like high blood pressure, heart disease, diabetes, something like that, that kind of puts you at a higher risk with obesity. And so it is not without risks. I mean, there are some risks outside of just the side effects. And so it is not for everybody. We have to really do an evaluation, a physical, a good medical history, and make sure that it is something that is safe. So for instance, it is completely contraindicated if you have a personal history or a family history of medullary thyroid cancer. When they were doing studies, particularly in rats, they did see an increased risk of that particular type of thyroid cancer. And so if there's a personal or family history, it's just not worth the risk. So we avoid it if that is the case. It also has been shown to slightly increase risk of pancreatitis. Knock on wood, I've not had a patient have pancreatitis from it, but it is a risk. And if you drink a large amount of alcohol, that is also a risk factor for pancreatitis. So those are two things you don't really want to combine. So I try to monitor the alcohol intake in most of my patients. It can also increase risk of gallbladder disease. And so if you have recent acute gallbladder issues, pancreas issues, then we kind of just avoid it in those situations. I have to look at my notes because this video thing is new for me. It is a weekly subcutaneous injection, which means it is given in just the fatty tissue, basically. So most people give it in either their stomach, kind of around the belly button, in their thigh, inner thigh, where it's a little bit fattier, or if someone is giving it to you, or if we are giving it to someone here, we can give it in the back of the arm, and that's a pretty easy place to give it. You give it weekly, so typically try to do it on this same day each week. When I see people, we start you on a very low dose and we slowly work your way up. You've got to see how you tolerate it. And the goal is not to get to the highest dose. The goal is to be on the lowest dose that you can be, where you're losing a safe amount of weight. And a good amount of weight to lose is 1 to 2 pounds a week. So if you were trying to lose 50 pounds, it is not most likely going to happen in a couple months if you're doing it in a healthy way. And I will do another video talking about kind of the steps that you can take yourself while you're on semaglutide to help with weight loss, because it is not just a magical shot where you don't have to do any work and you lose this weight. There are steps that you want to take if you're doing it the right way. And I always go over that in depth with my patients that I see. So I'll do a video on a little bit of that too. When I see patients, though, I do an initial in-person consult, which usually lasts about an hour. And we go over a full medical history, so personal history, family history. We do a physical exam. We get blood pressure and normal vitals, check your weight, obviously. And then we discuss various factors that affect weight. So obviously diet and exercise we discuss and go over changes that can be made there. But we also discuss things like sleep and stress management and things like that that can also have play a big role in your weight. I don't always talk about this at every visit, but hormones is huge too when it comes to weight. And so having those optimized is going to help give you the best results from any weight loss program as well. So it all kind of works together. Semaglutide has been found to even help with things as far as prevention of heart disease, helping with blood pressure, lowering risk of cancer. Certain cancers now, is that just related to the weight loss or a certain actual aspect of the way the medication works? They don't really have the studies yet for that I have seen. If someone has seen those, then let me know, because obesity is a high risk for a lot of those things. So just by losing weight, it does help prevent some of those diseases. So it is a good medication. It is not for everyone, and there are steps that you have to take yourself. So it is not just a no work type of treatment. But if you are interested in being seen for weight management, I would love to see you. And like I said, we do an hour consult, and then we do regular follow-ups that are a lot quicker than that. And we try to educate as much as we can, and I'll answer any questions you have. So if you have any questions, leave me a message, and I hope y'all have a beautiful and a blessed day.